So today we've got a stellar lineup of fantastic speakers, and I'm going to read the bios out to you so that you get to know who they are before we start our conversation. So we have Jereb Limo, who is the Executive Director of Ambassador for Youth and Adolescent Reproductive Health Program. She's been active in the SRHR HIV space for almost 7 years now, engaging in different issues and conversations involving adolescents and young people at community level, country level, regional level, as well as a global level. And she's quite outspoken, and she has great opportunities for her to sit in different boards, to echo the voices of young people and amplify their needs, and also to push for youth leadership and youth-focused solutions at different spaces that she gets to sit on, to speak on, or where she works or gets invited to. She's a board member at the National Network of People Living with HIV in Kenya, where she represents the voices of young people living with HIV, and also sits at the board of the National Network of Young People Living with HIV in Kenya, as well as at the board of the National Network of TB Champions in Kenya, as well as the Young Women HIV Prevention Board Council hosted by AVAC, where she sits as a council member, just to say the least. This is a very stellar bio, and she fully believes that young people and young women are strategically positioned, and they are definitely capable of designing, leading, guiding, informing, implementing the journey or road to achieving the desired change. Our second speaker is Sarah Milenkovska. Sorry, Sarah, for massacring your surname. Sarah is a researcher, a feminist, and a co-founder of the Stellar Network, a CSO working towards gender equality and solidarity. She has a background in gender studies, political science, and strategic communication, and she holds a Master's of Science in Gender, Politics, and Inequality from London School of Economics and Political Science, and a Master's in Strategic Communications from IKS Skopje. Her research delves into the heart of systemic inequality, exploring intersectionality, countering anti-gender movements, and amplifying the voices of marginalized groups, especially in the face of digital gender-based violence. As both a scholar and a practitioner, Sarah's approach is grounded in praxis, leveraging feminist principles for tangible political advocacy and community empowerment. As program manager of the Stellar Network, she spearheads initiatives that provide mentorship and support for women and girls, recognizing the transformative power of solidarity networks. And as a Chevening Scholarship recipient, she has leveraged her platform to launch Power of to launch. It's a share project scarcity of feminist literature by donating over 2,500 books in Macedonia. And multifaceted work, Sarah exemplifies the power in driving positive social change. And then last but not least on our list is Maximina Joconia. She's no stranger to us at Frontline Aid. And she's also the newly appointed Executive Director of Y Plus Global and the Her Voice Fund Coordinator. And she's established an HIV and gender equality advocate and young women leader. She has experience in health programming, focus on adolescent girls and young women, gender equality and women's empowerment, sexual reproductive health and rights, youth development and leadership. Maxi has previously worked to support children and young people living with HIV to access quality care through differentiated service delivery, and Maxi has taken on long and short-term roles in research, advisory boards, technical community body leaderships, including HIV vaccine and treatment trials in sub-Saharan Africa. So the proceedings for today will include input from our panelists. We'll have some dialogue and their input and some Q&A. And we hope this to be a discussion and not a one-way conversation. So please come prepared to engage with the issues as we are discussing. We were supposed to have had another speaker, Rania. I think we're having some technical issues. We tried calling her and asking her to join the call, but I think she's having some technical issues. If she does join us, we will include her obviously in our conversations going forward. Okay, so let's get started. So a little bit background on our side event. So this year, 2024, we stand a moment which is right commemoration and deep reflection as we honor the 3 decades. It's 3 decades, it's like 10 times 3 of remarkable achievements while actively shaping, the discourse that will define our future trajectory, particularly in the realms of the International Conference of Population and Development, and also the ongoing battles, frontline AIDS endeavors to secure a future free of AIDS. So with the imminent arrival of the Summit of the Future on the ST stage of the UN General Assembly, this year assumes an undeniable significance, marking a pivotal juncture in our collective journey. And so the 57th session of the Commission of Population and Development stands as a beacon. I mean, we're here right now in New York. I'm in New York at least. And just the conversations, the energy in the room, and just the screaming of progress, and then also emerging issues is very important as we move forward. And then just illuminating, the enduring relevance and profound importance of the ICPD agenda, especially in the face of mounting changes in opposition, which we are facing like head on. And so for Frontline AIDS, it offers a poignant opportunity for introspection, allowing us to assess and celebrate our strides in combating the scourge of AIDS, but also while reaffirming the critical need for unwavering dedication and sustained investment in this cause, as we celebrate 30 years of ICPD and 30th anniversary of Frontline AIDS. So the objective of this meeting was, what we want to do is prioritize HIV/AIDS within the ICPD review process and future policy frameworks, framing it as a feminist issue. For many years, it obviously was there. We were trying to push it, and we've been doing it all the time. But sometimes it tends to fall off the agenda. So we want to make sure that it doesn't do that. We also want to advocate the effective integration of HIV and AIDS with sexual reproductive health and rights. So we're looking at comprehensive approaches, integrative approaches, intersectional approaches of HIV prevention, treatment, and support services integrated with broader SRHR programming. We also want to highlight the detrimental effects of the anti-rights movement on HIV responses and human rights, how that could possibly be setting us back from the gains that we've just talking about here in New York. We're talking about all these wonderful gains that we've made. But also going forward with what we could be making, the gains we could be reaching. And so we need to discuss the tsunami that calls itself the anti-rights movement. And then also just we want to do some lessons learning. We want to learn from the HIV response, emphasizing collaboration, inclusivity, and from a rights-based approach. So we want to draw on the success stories of the HIV movement, and there are many, as we know, it was built on the backbones and the spine of women. But we also want to recognize the grassroots mobilization. And coming from South Africa, where the scourge of HIV was really, it hit hard, and the impact was hard on our community and our society. But we know there are many stories of how communities rallied and worked together to make sure that HIV now is just a chronic disease that we treat like we treat any other diseases, which is something that we didn't think we would ever reach. So on that note, I want to take us into our first speaker. And today we're going to speak to Jerop from Kenya. And I want to ask you, Jerop, as the Executive Director of Ambassador for Youth and Adolescent Reproductive Health Programs, do you think that ICPD 30 progress is visible in your region? Can you see it? Can you see the progress that people are speaking about at this meeting here in New York? And then can you describe what you think progress should look like? And what recommendations would you put forward to the Summit of the Future? Over to you.
Thank you so much, Yumna. Hi, everyone. I wouldn't say good evening or good morning or good afternoon because we're all coming from different regions, but I hope all of you are well. I'll just dive into your question, Yumna, and thank you for that. I think one of the most important aspects when it comes to regional or global commitments that our governments sign on to is really being able to showcase the implementation aspect of it. I normally say there's what is on paper vis-a-vis there's what we get to see on ground, which a lot of times don't resonate. So in terms of ICPD, I know there were a lot of conversations. There was a lot of energy, especially for us in our country, Kenya, and generally in the African region about our government signing into the ICPD. But I wouldn't say I have witnessed significant change that was contributed because of this agenda. Because there's so much gaps that we're still witnessing. There's so many issues that we're still seeing. You mentioned the anti-rights movement, or forces that we've been seeing across Uganda and Ghana. In our country, Kenya, we had similar bills, motioned in court. And it just places a lot of fear, because what has our government committed to, and what are they actually doing when it comes to implementation? So I wouldn't attribute a lot of the changes to that, but I would say that a lot has changed. We've seen increased access to services. We've seen improved access to services, but there's still more to be done. And I would attribute that to other efforts, but not necessarily tied into the ICPD agenda, because again, we need to be able to really assess and link our commitment to the ICPD vis-a-vis the implementation and what that has contributed to. Yeah.
Thanks, Jereb. I just wanted to ask you, the second part of the question is, what does it look like? What would progress look like in the communities that you're working with, and in particular with regard to HIV and AIDS?
Ideally for me, one, progress would look like equal access to comprehensive and quality HIV services. And for me, it's vulnerable populations being able to access comprehensive quality care without stigma, without discrimination, without limitation, as opposed to what we get to see, which is constant stockouts, discrimination against queer persons, gender issues, and a lot of stockouts that we continue to see. So for me, it would be access to quality, comprehensive, and that break it down to services that are tailor-made for the diverse groups of people living with HIV. We have key populations, we have young people, we have women and girls, we have the maternal healthcare side of it. So specified and curated healthcare services to be able to address the needs of this diverse population. Ideally is also just implementation of policy. When I think about agreements and policy, one of the biggest gaps we're having is implementation of policy, and even lack of progressive policies. It's saddening that for us, we can't talk about comprehensive sexuality education. It's still a taboo, or rather a conversation that is not being embraced. It's saddening that we're still criminalizing populations. So for me, it would be the other way around, where we are open and embracing each and everyone, respecting their rights, and providing services despite how one looks, how they identify, and what they decide to be. Yeah.
Thanks, Jereb. So definitely a gender transformer society is something we are working towards. And yes, I think in many ways we would like to do that. But there are, like you said, there are challenges and barriers to that. And one of the things that is standing in the way right now, it's becoming a lot more prominent as we move forward. And that is the anti-rights movement. And I actually want to take this question to Sarah. And just as a researcher, a feminist and a coordinator of the Stellar Network, and also just working towards gender equality and solidarity, and living in Macedonia North. What have you learned about the anti-rights movements, especially regarding history repeating itself? And I know that you were at the Benin Summit. do you think that the anti-rights movement is sabotaging the gains made and the gains to be made? And what recommendations do you think do you have in response to the anti-rights movement? Over to you, Sarah.
First of all, thank you for allowing me, to speak with these amazing people, and hopefully together we'll come to some answers, because it's such a big question, a question that on daily basis, I'm doing my best to kind of answer it, especially because I want to believe that we don't have, let's say, the privilege not to be hopeful about the future, because we need to think about better ways how to address it, but also, especially both as a researcher and activist on the field, experiencing the impact of the anti-gender movements on my well-being, but also in my work. It's really hard to remain hopeful and to not see the direct violence that occurs due to the politics behind the anti-gender rights and the anti-gender movements. So what we can see is that it's not just a local or regional, it's a transnational issue. And I think that's a really important aspect in how we want to approach something that can, in a way, both make us more aware about what is at risk, but also makes us more aware that we need to be united in the way that we are moving forward and creating these strategies of resistance. And I intentionally use the word resistance because I think it's going to get harder. Even though during the Benin conference, I was able to see, aside from me not being always an optimist, but to see more directly, the benefits that are being done and the improvements that we've seen on global level. However, as you said in the question, history is repeating itself. The anti-gender movements are not just a phenomenon that exists in the last couple of years. In the last couple of years, we've seen how they are more strategic. There is more funding going directly into international actors that either produce these groups on local level, first disguised as, the anti-vax, and then anti-gender, protecting the kids from gender ideology and all of this terminology. But it's also important to kind of understand that it's the impact that they have been doing. It's already seen not just in Uganda, also in North Macedonia, also in the region on legislative level. So you see how policies are being changed directly, not just the service providing that we see there is like lack of funding of, and we see that services are being reduced into some basic, even not being done properly, but you see how politics are being changed. And that's not just a reflection on the narrative, it's about also the behavior that the governments are allowing for this to happen, not just allowing, but they're also part of it. And here, I think really important aspect that we need to understand when we're talking about the risk of the anti-gender movement in general, and what it holds about, how can we redefine the future, is to understand that the threat is going to be long-term. And I think it's really important for us also, specifically in this current time of being, us doing here this process, this review process, is to also be really sincere and critical about who has the role within the anti-gender movements. Because while we're discussing this conversation, there are people who are part of the international community or international organizations that have anti-gender values or politics, and they held positions of power which impact how we further on create better strategies. So my point here was first to be really, aware, and that the fact that this is not something that we should take lightly. I think that we move past the state of urgency. But while I'm saying this, in a really critical way, I also want to use the opportunity to kind of learn from what we've done and to kind of celebrate the work that we've done, even though I'm really grateful, to hear everything that was said, especially because it gives me a bit more hope than usually, because we've done amazing work in sense of community building, grassroots organization, feminist organizing. So there are ways that we have improved. First of all, as being, involved directly into this. There are ways that we've seen how this has been improved. However, now it's a really important moment for all of us to think about strategies of resistance. And those strategies of resistance have feminist and queer practices that are relying on collective action, collective care, and processes of sharing knowledge and resources. And I'm saying this also with kind of caution because we're already doing, the field work. So we have to do, service providing, research, community development. So we have to do that thing while also thinking, how do we protect ourselves from the anti-gender movements? What are the resources that we have to, share the knowledge, share the ways that I can tell you the experience in Macedonia and you can tell me the experience in Kenya, and then see what we can learn from each other. But the point is also, while we're doing that, we also need to do the work that we're, as part of the civil society doing every day. And why I'm saying this is to kind of it goes back again in how I attempted to start more directly about who plays a key role in how do we envision these strategies. I was really, really motivated by what I saw in Benin because, to be honest, I wasn't expecting that much directly to talk about the anti-gender movements, because a week before I went to Benin, I was at another conference where the main issue about why do we have anti-gender movements was saying that feminists are too radical and too outspoken, and that's why we have problems with the anti-gender movement. And then a week later, I was a speaker at Radical Inclusion, and how important it is to be radical and how important it is for us to demand change of the oppressive systems through a decolonial perspective. So why we should use both this platform today, and I'm really happy to see what conversation will start after this. But we need to use the spaces that are not given to us, that we take, that we create, and we need to use those spaces as a form of creating those resistance, because we need strength, we need solidarity in all of this process, especially because while I'm talking about how the anti-gender movements impacts, laws, policy making, our well-being, it also impacts our security, our safety. It impacts our existence as well. And I'm saying this also to kind of try to summarize, because I don't want to take too much space. I want to, leave space for discussion. Is that I've seen, debates where they will say, oh, you need to take into consideration different opinions and so on and so on. But how do you debate with a person that thinks that you should not exist based on your gender identity or HIV status or whatever, aspect of who you are? So while we're trying to deal with people that don't want us to exist, it's really important that we are the ones that are giving each other strength. We are the ones that we, share the knowledge that we have. I'm really privileged to be able to study in London, but not everybody in my community has that. So I have the responsibility to share my knowledge and share the tools that I have for all of us to kind of move forward. And that goes in line with creating those strategies collectively. But for that, we need to be really critical where we stand, what are the resources that we have, and the resources that we need to move forward. I want to continue doing my work with mentorship, with solidarity, with everything that is going in line with what I always dreamed about doing. But we also need to be more aware about what is at risk and to prioritize. And hopefully together we can both prioritize where do we, create that resistance, whether we hold each other, and where we also take care of each other during that process. So I hopefully answered your question, but I'll think of something else as we go along, for probably that I forgot to mention. So thank you so much again.
Thanks, Sarah. I have something to build on from that. I just wanted to ask you, in terms of the anti-rights movements, and I know you've done a bit of research on that, are you finding that organizations that are normally considered progressive also slightly moving into that space? Can you talk a little bit more about that?
Yes, for sure. So without name dropping, I will do my best, because I think there are why I mentioned the resistant aspect is because I would like to see more coalition building. And there are feminist organizations that would say that they probably work, with empowering women and all that stuff. But we need to also to talk about liberation. So why I'm saying this is that there is a certain form of cherry picking which issues should be prioritized. And I think, especially now with the threat coming from the anti-gender movement, we cannot use intersectionality just as a word. It needs to be as a concept, it needs to be as a tool, it needs to be directly within our work. We cannot fight for gender equality and not talk about the issues with HIV. We cannot talk about, gender equality without trans women. So there are things that I've seen on local level, but also on like international level, where there is a certain form of, how would I say, a form of selection, like being selective on what certain organizations are being able to deal with. And especially I'm seeing this because even so, the first research that I did about anti-gender movement was as soon as I finished my master's, was in 2022, sorry, in 22. And it was focused on the impact of anti-gender movements on gender-based violence and the Istanbul Convention in North Macedonia. And for example, not most of the international organizations working in the region were even considering this as an issue. Only a few years later, 2 years actually later, you see how they're like, oh, this is now an issue. So I'm saying this why I think it's really important to be critical, but also to kind of call out the people working directly with gender equality about the role that they have to. I don't mind, advocating and making sure that more people learn in my community, but also on national level about what is the issue with the anti-gender movements. But I also cannot do the work of the institutions that need to protect us from the hate speech, from the hate crime that comes from the anti-gender movements. And also, when thinking about strategizing and creating that resistance, we cannot allow within the feminist and queer circles to be selective on which issues are we dealing with. And kind of that's why I mentioned the decolonial approach, which we need to have another webinar on and conversation. But we cannot directly address some of the issues without sharing our lived experiences and shared what our experiences mean for that policy making, for that international agenda, for everything that goes in line with what we're trying to deal with. And I'm saying this also as a call for, if somebody lacks the courage to, join in, ask the right questions, reach out to people, do your research, do your homework, because you cannot be a feminist without addressing these things. And sorry if I'm a bit, direct, but I stand where I stand, and I think that we don't have the privilege not to be direct and say that this is something that somebody else will have to deal with. So yeah, I hope that again I answered your question.
Thank you, Sarah. No, that was great. I just want to turn our attention to Maxi. I know you've now the newly appointed ED of Y Plus Global, but I know that your work experience, spans globally. And this organization, Y Plus Global, to mobilize young people living with HIV around the world and to promote their right to live healthy and fulfilling lives. Can you give us your reflections on the progress made in ICPD, taking into account the emerging issues such as COVID-19 pandemic, the climate change, and exactly what Sarah was speaking about, the anti-rights movement? Over to you, Maxi.
Thank you so much, Muna. So I love to say Yumna.
Thank you so much for the opportunity. And just to say to the previous panelists, thank you so much for this really great insights. I'm totally 100% agreeing with all of you in terms of what are the current gaps when it comes, to under rights movements, but also connecting to ICPD work that has already been done, like what Jerome has already shared in terms of disconnectivity on what is in theory versus what is being happening in different countries that we are currently in. So us as Y Plus Global, as you know, that we are always working with young people living with HIV, but also in our diversities, looking at different intersectionalities that affect us as young people, including the current, kind of priorities under ICPD, and also connecting to what Jerome has been saying in terms of what have we managed to access as young people versus what has been promised to us as well. So those are some of the things that we've been exploring, and also working at Y Plus Global. Those are some of the key issues that we've been focusing on. One thing we could also agree is that the HIV agenda is a feminist agenda. It is a feminist, it's at the core of what we do. And it's very sad sometimes that we constantly have to fight in these different spaces just to talk about the issues of HIV as if it's something that is already done. Like what you highlighted, Yumina, is that even in the future, Summit of the Future, we are trying to table the conversations of HIV, and in many spaces and conferences, you no longer hear the conversation, but you're talking about the issues of quality of life for young people. What happens after even 2030 that you're talking about? They are forgetting that we are living in this life. For example, if this is our life, we're living with HIV. We have these different intersectionalities that are affecting us, especially us as young people. So just us not having the actual conversation, and that's why I really appreciate this webinar, because it allows us to have a platform to really unpack what we really want as young people and what we are seeing. As Y Plus Global, we have been working on different aspects of the rights and the needs of young people. The first one that we've been really pushing for is engagement and ethical and meaningful, participation of young people at key decision-making platforms, which for a long time, I think it has been tokenistic. As much as possible, as we are saying that we have one person who's sitting at a board, it doesn't really equate to the representation that we solely need for the voices and our issues to be addressed as much as possible. So this is the kind of work that we've been doing across all our projects as Y Plus Global, but also connecting to ICPD agenda, looking at the issues around accessibility of services. As much as it's still lagging, I think we've made some really great strides in terms of some of the projects that we have on board. For example, the Ready project, which is looking at young people living with HIV across 7 countries in Africa. We have got the Ready movement that is looking at young people as a holistic approach. Like what Sarah said, it's high time we move away from silo programming and be more collaborative and being in consortiums and in coalition, sharing some best practices, sharing some, key lessons learned, and also how can we learn from each other as much as possible. So this is what Ready movement is all about, bringing young people's networks across the globe, coming together and have one agenda and push it forward as a collective. So as Y Plus Global, this is why we are here. This is what we stand for young people to come together and have one agenda. So this is what we've been doing so far. Amongst other really, other projects that we've been running as Y Plus Global. I think one of the things that we've also tried is for young people to be part of the technical working groups. For example, we can talk of the country coordinating mechanisms that speak to the Global Fund, but also national processes that happens in country. If it's a national strategic plan, how do we become part of it and all of those things? But with COVID-19, I think we also learned how to evolve, and we've seen young people playing a really critical role in terms of connecting the community to the clinic. Young people became the peer supporters for our young people with HIV, bringing that kind of gap that was there and bringing it closer the clinic to the community, where young people could actually go with the ARVs to the young people who were at home, were not really free to go to the clinics and all of those things. So we've seen that kind of why community should be at the center agenda, like what we always talk about, and why we are critical in the HIV movement as much as possible, especially in our space as young people. Young people taking, as much space as we could. I think also Jerome also highlighted in terms of what other platforms she's also sitting on. This is some of the work that we've been doing as Y Plus Global. Then in terms of integration and intersection, I think we've started to talk about HIV and hepatitis, and also look at other aspects that affect us as young people. For example, you mentioned climate change. We have started to be in those conversations, see how does climate change affect us as young people living with HIV, and how do we be on top of the agenda so that we are not left behind, and we are leading our own, movement as much as possible, and be on the forefront of confronting what is coming ahead of us. So those are some of the really, work that has been happening. But I would then echo with my colleagues here to say, they still need something that we need to do all of us together, because we are not hitting the nail as much as we want. So I think those are some of the things that I definitely agree with Sarah, with Jerome, that we need to do so much from, harmonizing fragmented, programming that has been going on for a long time. We have ICPD agenda here. We've got the Lusaka agenda here. We've got that agenda there. How do we bring it together to harmonize it and have one agenda? It's HIV. So HIV shouldn't have these different, agendas and confusing us. And at the end of the day, we say, oh, funding is going down for HIV, but it's all of this fragmentation that is happening that we are not really thinking about. So that's the first part that we need to start thinking about. The second thing, am I going to your second question?
No, it's my second question. You're like right there on top of it. I just wanted to say, what are some of the immediate actions that we can take? And you're like just building on it. I definitely think, what are some of I think what I want to ask is, what are some of the immediate actions that we can take, but that requires little effort? Because, everything requires so much effort, but little effort, but with a big impact. And
definitely.
So especially when it comes to the lived experience of marginalized communities and population, what are those things? And we can't, we've been working in communities for so long, but somehow, like you were saying, everybody else is saying here, is that we are missing something. So I'm asking, what are those very basic stuff that we are missing? That we are just not clicking into. So just a little bit about that, please.
Definitely, just a little bit, like I highlighted, let's do away with fragmentation. It's very important. It's something that we could really start to think together. If we need to table it at the Summit of the Future, because we're talking about the future, right? Let's have that kind of agenda. So how do we harmonize different aspects? We've got really strong principles when it comes to feminist movement, right? How do we apply those principles to everything that we do? I think that way we are able to move forward. I think in terms of us, something that we've learned already, we know this, that HIV to be where it is today, it has to be centered in the community. So how do we use or utilize and leverage what is already in existence versus creating something new? We have community movements that are already there. If you go on the local, we've got peer supporters, we've got community-based organizations that are working, that have got robust interventions that are working, that are leading CLM, for example. How do we build on what is already existence so that we amplify that and maximize on it as much as possible and learn from those best practices, right? I think for me, that's something that is low-hanging fruits, and institutionalize that, because sometimes we say community work, we don't recognize it. When do we start to recognize community work? Because it's very vital, and most of the gains are as a result of community. So for you not just to institutionalize it, it's your choice, but that's something that we can start to work on as we go on. Like what Sarah has already highlighted, let's work on the anti-rights movement. I think the threat is way bigger for us to control, to keep quiet. Let's name it. Let's start to have real conversations about it. Let's find other connections that are anti-rights movement and also include the issues around colonialism, around the issues of red tape funding and all of those things, and start to have real conversations as much as possible. But at the same time, we keep in check in terms of our securities as communities and all of those things, because it's really vital. At the end of the day, we also want to save our communities, being safe, but also addressing what is harming us at the end of the day. It's really important. And really addressing those human rights issues, I think that's, for me, it's very important. Who's at the table, who is speaking on behalf of who's got the privilege in the room, and be able to speak much more about it. Then also on funding, I think there's still a lot of red tapes that are there. I love feminist principles. Sometimes, those kind of funding that we do get allows us to really work on the real issues without looking at those red tapes that have been really largely, affecting us. It doesn't allow us to address the actual needs that we have on the ground. I am the one being affected as a community, as a young person. I know exactly what I want at the end of the day. Allow me to do what I think the other young people could actually, benefit from. Then measure from that and see if it's not working. So that's what I would urge all those, let's decolonize, those red tapes and all of those things. I have a lot of things. I talk a lot, as you know, Yumna. Let me stop, and I'll be happy to then engage more in the dialogue as we go on. But I'd really love to hear some more, ideas, from the audience, and to engage and all of those things. Back to you, Yumna. Thank you.
Absolutely. Thank you, Maxime. Wow, wow, wow. How much more can we say? But I think what's important, this is to be a conversation, not just a presentation, right? So what I want to say is, just building on from what you said, I think the lived experience is something that we cannot ignore. It's something that, in the past, and having been part of the HIV movement for 20 years, it was always, we will decide for you. And I mean, that's nothing with us, for us, without us. We came out because it was, disregarding the lived experience, and we've come to accept that the lived experience is the most important aspect, and it's something that all three of you had raised. But I think when we are working with the anti-rights movement, we are finding that even though we're presenting the lived experience to people, they are not responding, and we need to ask the question, why? We are presenting this evidence. Why are people still ignoring the evidence? I mean, claims that what we are doing as a human rights approach is a Western concept, yet we allow the US to come and tell us how we must run our families, and divide and conquer, and ignore single mothers, and ignore, same-sex parents. So what are we saying? What are we missing in terms of this lived experience that we are saying is so important? And I think, you put it on, you hit the hammer on the nail, Maxi, when you were speaking about decolonization. But I think when we link that to privilege, in the sense that we tend to think, we, like in South Africa, we are 20 odd years out of apartheid, but privilege is still permeating our societies. We can still see where the money lay. We can still see where the power lay. Who makes the power decisions? Things have changed, but transformation takes a long time. And so it's being patient with this. But it's also about what you were saying, Sarah, about when we spoke about coalition building. It's about collective action and considering these issues as we go along. So I'm not going to carry on here. I want to open this up to questions and answers and conversation and contribution from the audience. Please, are there any contributions? Please, just if you want to shout out, it's fine also. But yeah, we would like to hear, because I want to know more about what we can do, about why are we missing that little bit of information, that action that we're just not getting to. So I'm going to open it up. Are there anybody that would like to contribute at this point? Claire and Naz and Mitch, can you see any hands? Yeah, Sibusiso. Please go ahead.
Good morning, good afternoon, everyone, and thank you so much for this very important discussion. I was actually very excited when I saw it on the agenda because, like some of the speakers have highlighted, this is not a conversation that we have in the different feminist spaces. And it's just very interesting to hear the insights that are coming out in terms of how we are linking HIV as a feminist issue. I just wanted to highlight that as someone who's been working within this sector for a few years now, it has been increasingly difficult to actually push a social justice response to HIV because it's really more biomedical in a lot of ways. And so my point of raising this is to continue to highlight the importance of why we need feminists within this HIV space, because if we have to address the structural barriers, right now we're talking about the anti-rights movement. We also have like criminalization of certain populations, for example, sex workers, people who are using drugs, who often are discriminated against in terms of trying to access services. But then that's just accessing services is one layer of it, but the quality of life of a person goes beyond accessing services. And so we see most of these responses that really speak to the biomedical aspect of a human being when we know that a human being is more than just the biomedical aspect. And I think when we're in a space where people are more focused on the medical aspect of it, it is important for us to have more feminists again within that space to kind of bring the social justice aspect to it, the human rights aspect to it, if we're actually to comprehensively address HIV and get to the 95 goal that we keep preaching about. Because without that, I feel like we've made strides, yes, like most of the countries are almost reaching those goals. But the last percentage that we have left really has to do with us addressing the structural barriers that people face within their lived realities as they try to access services. So I think we need feminists so that we can go beyond biomedical interventions and actually get to structural barriers, including addressing the laws within the different countries where especially we see that the impact of HIV has been quite destabilizing. Thank you.
Thank you so much, Shibasisu. Woo-hoo! Yes, we definitely need more feminists. And it doesn't just need to be a female. You can be anyone else, but we definitely need more feminists. So I'm going to go over to Tahira. Please go ahead, Tahira.
Okay, good day, everyone. My name is Tarida from Nigeria, and I'm glad to have joined this session. My contribution on what has been discovered so far is that I work with people living with HIV in Nigeria here while I was serving the country, and I realized that out of 100%, only about, let's say, 20% of women are supported when they come for their ART appointments. I realized that some of them, it got worse to some extent, that some of them, their husband declined them having the ART appointments, knowing that in Nigeria, there is this patriarchy, there is this men being the leader. So whatever the head of the home is saying, then the woman must comply with it. It got to a stage that there was an instance whereby a woman was pregnant and she was HIV positive. But due to the fact that her husband did not fully support her, it was a critical one, especially for people who are taking care of these people living with HIV. It is difficult knowing that there are men at home who are discouraging these women on taking their drug, which will also impact on the child, on the infant growing up, who might be HIV positive if the woman refuse to adhere to her ART medication. So my own contribution is that truly it is good for feminist women coming up to support the HIV intervention, but I will also encourage more of men. I don't know if we have more men in this Zoom session. We are supposed to be having men supporting this intervention, because I realize that men are more supported in this HIV intervention than women. I've had to organize HIV programs across markets, to know the view of people. Before I know it, most men that I interviewed, I spoke with on HIV, most of them were telling me that these women are having extramarital affairs. That was why they are having HIV. So there is this stigma attached to women having HIV more than men. So my conclusion is just that integrating and educating men, not only we women, I'm very sure from this Zoom session, there are little or no men among us. So it is more like a gender war or discussion. Meanwhile, it is supposed to be a collaborative effort. It is when men and women, old, young, come together. That is how the HIV intervention can be fully achieved. Thank you very much. I'm really grateful for the frontline aides for bringing up this discussion. Thank you.
Thank you so much, Tahida. I'm going to give the speakers a chance to respond to those inputs, and then we'll move to the ones that's in the chat. Over to who's going to start? Shall we ask Jereb? Will you start?
Thank you, Yumna, and I totally love what my amazing panelists have mentioned. Ideally, yeah, I feel like I've gotten the energy and the psych to push and to keep on fighting. But I think one key aspect that is important is, and a lot of times as organizations, as advocates and activists, we stop at a policy or the government has made a commitment, but nobody really follows through to look at the implementation part of it. And I think that's number one where we fail, because I would say, oh, my country has committed to the ESA commitment, but who goes to actually hold these guys accountable to the implementation bit of it? And I think that's one of the problems we're having. These are policies and documents that exist and treaties, but with zero implementation framework, zero M&D plan, so we don't get to really follow through and assess. By the time we are talking about this policy and these treaties again, it is when now our governments need to resign on, or we need to review this policy. Well, all this along was a document that is beautiful and it was seated on the shelf. So implementation and M&D is such an important aspect in the work that we do. We need to keep on assessing. We need to keep on asking ourselves questions, because that provides an avenue for us to re-strategize, to figure out who is the new leader, who is our ally, who is the opposition, how do we handle this, how do we go about it? Ideally, also the thing would be, really pushing for beyond biomedical support. I really liked what was mentioned, because even with the current Global Fund process, we are seeing a lot of resources supporting procurement, medicine, we want to equip this, but nobody's thinking about structural, social barriers, which are key issues that our communities are facing. Even for us as an organization working at the community level, it's becoming quite difficult to prove why I need resources for a support group, for example, why I need resources to have a human rights training, why I need to empower the community on SOGI. It's becoming quite difficult to prove, because everyone is thinking sustainability, and sustainability looks like equipping a facility with medicine and it ends there. So there is need for beyond biomedical resources and interventions to be funded, and ideally community-led interventions by the people for the people. Lastly, I think it's the aspect of power dynamics, and a lot of times it saddens me because people make policies with their biases, with their cultural perceptions, with their personal interest, and little do they ever think about the people these policies are meant to serve. And that is what I think when I think about the anti-rights, gender and agenda and conversation in our countries. It's people who just sit and decide, because I'm a quote unquote Christian, I am an African, so this is what my culture says, and this is what I think, the policy should look like. We are trying to protect our culture, but ideally, I think individuals with these high positions are protecting their own interest and their own biases, forgetting that these documents are there to serve other people and not them. And ideally, they also have privilege. And that's the truth. They'll be able to access the highest level of care. They'll be able to access medicine, the doctors. But me at the community level will get judged because of how I'm dressed, will get chased away because of how I, identify and express myself. So one, it's the power dynamics and, the reasons that policymakers approve and put, signatures on policies and documents, as well as, who gets to decide. I sometimes wish we had the opportunity to put individuals and people, representatives of the community, in policy making decisions table, because then we'll be able to influence. But like Maximina mentioned, it's not about one young person. It's not about, two people. It's about holistic and harmonized efforts to be able to shake the status quo or to change the narrative. And I'm looking forward to more harmonized efforts across the globe. Can we take our efforts to Uganda as a society, as a civil society? Can we take our efforts to Ghana and question and support our brothers and sisters and, just pour our voices and ask questions? But also, can we utilize the experiences and the data, and the voices of the people to showcase why we need more progressive policies? It sucks that our data is not considered as data because we are community, we are civil society, and the government just wants to use their own data. But where is our place as the people who do the groundwork, as the people who experience the lived realities of the people? And can we use these experiences to really push for more progressive policies?
Thank you so much, Jereb. I'm going to go quickly before we go to Sarah and Maxi. I just want to read out what I'm finding that's being sent to me. We have a comment saying that, it's a great comment on structural barriers. It's a critical aspect in our program building and consideration as we design new and current projects. And Jereb, you picked up on that 100%. And then there was another one coming through saying, what can happen now with CPD 57 to bring these issues to member states? What's the role of funders in supporting efforts to defend the rights? And I just want to say that being yesterday at the opening session of the CPD in the General Assembly yesterday, when we had countries reporting, it was just astonishing how the issues of LGBTI communities was completely ignored. People using drugs was ignored. People that are sex workers were ignored. But everybody was reporting, some of the countries was reporting, oh, they're doing well, they progress. But somehow certain areas was, for me, I felt that there was deliberate exclusion of those communities. And so now more than ever, and I'm just listening to this conversation, I think now more than ever, we need to push that hard. And so while we are still here, and those of you that are on the chat and that are on this, participating in this session, and you're in New York, please, if we can raise this issue, and it's definitely something that was very stark in yesterday's reviews. And then there's a nice comment here from Anne, who says that this is such a powerful session. Thank you so much for all your hard work. And pardon me if this has already been discussed. And this is such an important issue that she raises. But what about voices of those belonging to the older age? Groups that deal with stigma and discrimination that stem from an HIV diagnosis. How can we better advocate for this? And no, please don't apologize, Anna. This is such a true issue. Help Age is working on it, and in the beginning, Help Age for me was the only organization that was really working on it. And I think we need to push it harder, because with the success of the HIV movement, we had medication, we had treatment and care, which means we have communities and people in communities living longer, instead of having to die from an early age from HIV and AIDS. So what are we doing around these issues? And I think it's so important. And it's important from a feminist perspective, because often it's the women again, and the women and the marginalized communities that are taking, that are on the receiving end. So now I'm just going to carry on and just ask Sarah and Maxi. I'll go to Sarah first. What are your thoughts and reflections on the input that we got so far?
Oh, first of all, I am so amazed that, for example, how in online space you can see how powerful this conversation can become. And I imagine if we were together in a room, and we were discussing all of these things. So I'm really thankful and honored that I can contribute together in building the resistance. And it goes in line what was already says. We are building on each other's battles. We're building towards, what was done before us. We came here because somebody fought for us to be here, but now we need to continue that. And how do we continue? That's the questions that we're answering every day. And I also want to remind us to kind of allow us to fail sometimes. It's to test certain things, what works, what doesn't work. And I'm saying this because you mentioned something really important about how are we not getting to the point, because we share our lived experiences, we share what is going on, and still that's not enough. And I have a really simple and awful answer to that, is that narratives impact the dehumanization of our stories. So our personality, the personality of people coming from different marginalized groups is being stripped because of the words and the narratives that already exist, that are built on the power structures and the structural barriers and everything that we kind of inherited in this world. But the point is, how do we find better ways to make ourselves human again, unfortunately, because we have to debate these things, is to make sure that, sorry, like I use sarcasm, but I have a good point, is to make sure that we understand that this is a long-term battle, and to find allies in spaces that we weren't always, looking for. I think there are people in between, and I don't want to use terms like the middle ground or what, the average people or whatever. No, there are people that are allies, but they're not always on the front line as we are. And I think here, doing that community work, doing the conversation, bringing them closer to what we're doing, us going closer also, we need to move our own perspectives as we go along. I think that's something that we've tried here in Macedonia and has actually worked. We meet with like parents, professors that are completely off, outside of these networks, but we talk about the impact of the anti-gender movements. And what we realize, and I think is really important, is how we are making our struggle more accessible. And what I mean by this is, what is the language that we're using? So, for example, one of the main narratives in the region here in Southeastern Europe is that gender equality is a Western concept and all that stuff, which is, the typical thing. Well, the anti-gender movement is being funded by the West. The whole ideology, the academics are coming from the UK and the US. And I think that's something, it's a good way to kind of demask what those anti-gender actors are actually for, because they're for remaining the status quo, for power and interested. So kind of trying to demask, and this is why we need, for example, investigative journalism. This is why we need allies in places we weren't thinking before, because we were so deeply into our, our own battle. The point is how to make sure that we're going beyond what we already have attempted to do. And it goes in line what was mentioned about the community building and making, the community work relevant, and as well as even in the research. So I call myself researchers, but I'm not, an academic or a scholar or something fancy or whatever that means, because for me, research is the field work, research is the collective work, research is the what we do on the ground. And this is why I mentioned the decolonial approach. My research doesn't need to be in English for it to be relevant. And that's really important aspect, because for our stories to be relevant, because even the anti-gender, the talk about the anti-gender is becoming again a bit colonized, as who is getting the funding to do the research, who is getting, prioritized when we're having this discussion. How I make myself relevant and my region relevant, I need to do both the field work, both the research, and make sure that that's translated in English. So what I'm trying to say here is to be also self-reflective within the feminist movements. I'm not saying, it's our fault, but we should do a better job. And how we do that job better is by allowing to see that how we should become more connected and remain within our communities whilst trying to build this transnational resistance. And that's super hard, and that's not easy. And we have one lifetime and energy and resources and mental health. But that's why we're also having this conversation, in order for us to build on what's already behind us and how we move that forward, in order for us to be critical and see who has the role in the different aspects of both the resistance and both within the anti-gender movement. So hopefully I kind of reflected on the things that were said, because I wanted to kind of connect what was already being said in kind of an overall idea that we have more than we think we do on our, in our tools, in our arms. But also we need to ask for responsibility about how the anti-gender movements is becoming institutionalized. Gender equality is being erased in the local municipalities in North Macedonia due to the anti-gender movements. And that's just a small thing on what is actually else happening, and all the levels in which we see criminalizations of our existence. So yeah.
Thank you. Thank you so much, Sarah. So Maxi, just in a nutshell, as we are busy closing out, we're going to be running out of time soon. Just a few words from your side.
Thank you so much, Shimna. Jerob and Sarah already, highlighted some of the great points that I'm really 100% agreeing on. On structural barriers, yes, we need to go back and really interrogate what exactly is not working, and how do we, come with mitigation plans, a collaborative approach and multi-sectoral approach in terms of how we can address some of those things. Real conversations, who's at the table, who's speaking on behalf of who. I think it's really important, like what Sarah was already highlighted. From my side as well, I think the most important issue is around also access. We highlighted that access is not the only thing. Our lives is people living with HIV goes beyond just access. We need to look beyond that and be more holistic in terms of our needs, as much as possible. Then in terms of the other comments around, how are we engaging men and boys and all of those things, I think we are really working with them, right? Like we always say, feminist is just not, it doesn't equate you being a woman. It's about a principle that you're applying. That's exactly how we look at it. So we also have men that are also feminists, that are our allies, that are working with us as much as possible. And some of them are even working in this movement. But what I'd love to actually say is that it's not a question is how are men engaged and supported and all of those things. I think the way I would love to look at it is who is affected the most or infected the most, who is being affected by the laws that are being implemented, and how do we better support each other in that aspect. Because even if we look at a whole aspect of HIV as a movement and who's mostly affected, we can now, with the anti-rights movement on the side, we can actually start to see that our LGBTQI communities are the most affected and mostly at threat at the moment. So who do we prioritize at the moment? I think those are the aspects that I would really love to propose to start to think about. But definitely 100%, let's engage men, let's engage boys as much as we can. I'll leave it here. Because I know time is
Thank
run out.
you. Thank you, Maxi. I just want to say, as we're closing out, the countries in the South, we have developed some very forward-thinking commitments. We have the Maputo Plan of Action. We have the Montevideo Consensus, the Asian and Pacific Ministerial Declaration on Population and Development. These are such forward-thinking. So let's not get distracted from what we have. Let's focus on that. Let's build on that. Let's implement what we say. Let's put our money where our mouth is with regard to these commitments. And while we have wonderful foreign feminist policies coming in from governments from the West, as well as Mexico, the other country, we need to start thinking, is that another form of colonization? Yes or no? And yes, where do we collaborate? Maybe we should ask those very countries with those very forward-thinking feminist policies to also turn it not just to the South, but to turn it back onto the West and onto the Northern Hemisphere and ask the US, for example, hello, what are you doing with Project 2025? What are you doing, Hungary, with all of these other anti-rights movements that we have? So I want to finish it off there, and I want to say this is just the beginning. We need to continue this conversation. We're going to take it in, and my colleague Claire, I think she's left already, but we're taking this conversation to AIDS 2024, and we're taking it on to the Summit of the Future. So please stay in contact with us. Invite us to your events. Come to our events, and let's continue this conversation, and let's move the feminist movement so that we can start having real good gender transformative societies. Thank you, everybody. Thank you for coming. I want to continue with this the whole day, but we can't. And thank you so much to our wonderful, wonderful speakers for this very valuable input. Thank you, everybody. Thanks. Bye.
So much. Bye bye. Take care.
Bye, everyone.